Thank you, Bala. Welcome, everyone. All right, the welcome Zoom wave, the Rotary Zoom wave. I love it, I love it, I love it. It is great to see you all here today. Thank you for joining us again, and welcome to all of our guests. We have quite a few guests today. We have 9 of our 10 scholarship recipients, the recent Wooster High School graduates and their families, who will be hearing more about today as Frank gives us the scholarship program. One quick announcement, a couple announcements. You may have heard as we were talking a little bit earlier, Sataro, our third exchange student, the only one who is still here in Worcester right now, is here for this week, and he will be returning on Friday. He leaves Friday to return to his home in Japan. And Huli and Lou are both en route or almost home. Today and tomorrow they are arriving. So safe travels to Sataro, and we look forward to hearing from him again after he gets back to his home. One other announcement, I ask you to please keep past President David Briggs in your thoughts. As you may have seen, Secretary Lynn sent an email out earlier this week saying David has been diagnosed with terminal lymphoma. Lynn shared his address if you wish to send him a card or a note of good wishes and good thoughts. If you don't have his address, you're welcome to contact either Lynn or me, and we can get that to you. All right. At this time, I am going to turn things over to Frank Relli, who is our scholarship chair. Frank, you will have to unmute yourself.
Thank you. For those students that are guests, why don't you give us a big wave so we know where you are? Great, thank you very much and congratulations. Do you have our slides to put up? Okay, perfect, can you all see that? All right, let me start out by saying congratulations to you, graduations. Next. So you may ask, where do all these students get their scholarship information? And locally, one of the driving forces is the scholarship guide that was initially created as a partnership among Wooster Rotary High School, the Wayne County Community Foundation, and Rotary 18 years ago. It's mailed out just before the winter break to the home of every senior attending one of the participating schools. This collaboration has grown to include 8 local high schools and lists over 270 scholarships that were typically awarded to students, local students. Next. Well, in lieu of a seniors awards assembly, a 50-minute video was created that aired on Thursday to recognize and celebrate the many achievements that these awards, many achievements of these students. These awards were not made public until they were first announced on this video. Next, please. Each student received a packet that was mailed out Thursday afternoon to arrive Friday or Saturday at the student's home and contained a certificate signed by Club President Kim Sayers, an award letter of congratulations and explanation, an invitation to today's recognition Zoom meeting, and a recipient information form, which is due June 15th to Greg Long at Cook Long SAMHSA or Lacey Neal at the Wayne County Community Foundation. Now, this is pretty important for the students because checks must be sent to the school in which the student is enrolled, and that's got to happen prior to the Rotary's fiscal year end, which is June 30th. Next. Including this year, the Wooster Rotary Club has made 191 scholarship awards for nearly $346,000. In the last few years, we've had over nearly 420 Rotary scholarship applications. And since we award 10 awards, there's an average chance of roughly 1 in 5 of receiving a Rotary scholarship. This is significantly better than many others who receive as many as 10 to 20 applicants, all competing for just one award. Special thanks go to the Rotary Club Scholarship Committee, to Julie Hammond at Worcester High School, Lacey Neal at the County Foundation, and Greg Long, our treasurer, for their assistance in finalizing these awards. Next, please. Here's a listing of our 20-member scholarship committee. We certainly appreciate their energy, their enthusiasm, and their dedication in.
Are you on it?
I had been, I don't know.
You there? Energy, enthusiasm, and dedication in evaluating these applications. Next. Each evaluation are based on scholarship criteria, financial information coming from the FAFSA SAR forms, a biographical essay, and school transcripts. Names and identities are blacked out to eliminate conflicts of interest. Each committee member rates each application as a 1 being the first choice, 2 is the second choice, etc. Applicant scores are summed up. The lowest score represents the highest ratings. The biographical essay is very important.
Yeah.
We want applicants to describe themselves, their achievements, their goals, and why they should receive this scholarship. Next. Rotary funds its scholarships 2 different ways. There's a total of $18,000 were made this year. There are 4 endowments at the Wayne County Community Foundation for $7,000, and Rotary then budgets $11,000 each year for its scholarship participation. The Rotary Scholarship Committee handles the evaluations of the candidates of both the club and the Wayne County Community Foundation Rotary scholarships. Next. So let's turn over to the awards night. It started out with Kim Sayers, our club president, who produced an introductory video about Worcester Rotary's support of educational opportunities. Next. This was followed by Mr. Egley, who announced Rihanna Velasquez as the recipient of the Worcester Rotary Art Scholarship. Next. This scholarship originates from the net proceeds received by the Rotary Club of Worcester's annual participation in the Worcester Arts and Music Fest. Eligibility is that the applicants must be current graduating seniors of Worcester High School, have a minimum of 3.0 GPA, and have demonstrated significant experience and participation in the visual and/or performing arts. It's a 1-year, $1,000 award. It was given to Rihanna Velasquez. She'll be attending the Ohio State University and plans on majoring in molecular genetics or neuroscience. Rihanna is also one of the 4 valedictorians of the class of 2020, and much of the artwork that she produced in the last 4 years has been seen in the school newspaper. Thank you, Rihanna, and congratulations. Next. Ms. Cheryl Goff announced the 5 recipients of the Worcester Rotary Club Scholarship. There were Stuart Corson, Steele Morgan, Ariane Patel, Bryn Savage, and Kayana Stodmeyer. Next. The eligibility for this is a senior who has a minimum of 3.0 GPA, and awards are based on financial need with consideration given for academic performance, personal character, and leadership potential. There are up to 5 awards that can be made. They're a 1-year award worth $2,000 each. The first one was given to Stuart Corson, who will be attending NYU Tisch School of the Arts, majoring in drama. Congratulations, Tisch. Congratulations, Corson. Stuart, I'll get it right eventually. Next, please. Also receiving $2,000 each are Steele Morgan, attending Ohio Northern University, planning his studies around mechanical engineering. He'll actually be joining his brother up there, who got this award last year, who's working on civil engineering. Also, Ariane Patel will be going to Case Western University, studying in biology. Congratulations, Steele and Ariane. Next. $2,000 also goes to Bryn Savage. She'll be attending Kenyon College, and she'll be studying environmental sciences. In Kayana Stoudemire, who I think is going to Wittenberg University in pre-vet medicine. Next, please. And congratulations. That was followed by Miss Ann Robeson, who announced Ashley Siegel as the recipient of the Sam Shapiro Scholarship and Sophia Van Sickle as the recipient of the W. Lee Culp Scholarship. Next, please. Sam Shapiro was a native of Worcester. At 99, he passed away in February of 2018. He was an Ohio State graduate, a World War II Marine Corps veteran. He founded Wayne Steel, established Metallics Recycling, Summit Steel, and Akron Rebar. He was a humanitarian, a philanthropist, and a community leader, serving as president of the Wooster Rotary Club, the YMCA, Boys Village, now the Village Network, Worcester School Board, and Knesset Israel Temple. He was a major contributor to the Ellen Shapiro Natatorium. The Sam Shapiro Scholarship was established in 1997 and has been awarded 24 times for a total of $58,000. Next. The Shapiro Scholarship goes to a Worcester High School senior who has a minimum of 3.0 GPA, is hardworking, and deserving of the scholarship. Awards are based upon financial need with consideration given for academic performance, personal character, and leadership potential. So one-year scholarship, an amount of $2,500. And it went to Ashley Siegel, who's attending Ashland University. She'll be studying early childhood education. Now, she got a pretty good jump on getting into school because while she was at Worcester High School, she took the college credit classes over at Wayne. And as she was I think accumulated close to 60 credit hours already getting started. Congratulations, Ashley. Next. Lee Culp passed away in 2012 at the age of 95. He was president of the College of Worcester class of 1941. He was a U.S. Marine Corps veteran of World War II. He served in Guadalcanal and Okinawa and was awarded both the Silver and Bronze Stars. He was recalled active duty in 1952 and served during the Korean conflict as a lieutenant colonel. He served the College of Worcester as director of admissions, alumni trustee, director of development, and retired as registrar in 1985. He's the creator of the annual IS Tootsie Roll custom, which still continues today at the college. He was the Worcester Rotary Club secretary for a record 35 years. Worcester Rotary Club established the W. Lee Culp Scholarship in June of 2001, honoring his commitment and dedication to the Rotary Club of Worcester. Next, please. Eligibility for this is a Worcester High School senior who has a minimum of 3-point GPA, is hardworking and deserving the scholarship. Awards again are also based on financial need with consideration given to academic performance, personal character, and leadership potential. A $1,000 scholarship in the amount of $1,500 went to Sophia Van Sickle, who will be attending the University of Kentucky and studying political science. Next, please. Ms. Jaime Gerber announced Anna Ciccello as the recipient of the Leroy and Helen Adams Community Service Scholarship. Next, please. The Reverend Leroy Adams and his wife Helen were outstanding African-American leaders in the Worcester community and exemplified local volunteerism and the Rotary motto of service above self. He was a U.S. Army veteran during World War II. The Reverend Adams passed away in 2001 after a 35-year pastorate at the Second Baptist Church and a 28-year teaching career at Boys Village, now the Village Network. Leroy was Worcester Rotary President in 1993-94, and Leroy and Helen Adams Scholarship, the Community Service Scholarship, the fund was established at the Wayne County Community Foundation by an anonymous donor to honor the lives of these civic leaders. Next. Eligibility for this is for a a Worcester High School senior accepted to a accredited 4-year college or university, who has exemplified outstanding volunteerism and philanthropic service. It's a 1-year, $1,500 scholarship, and it went to Anna Cicello, who will be going to the University of Cincinnati studying medical sciences. Anna has provided over 100 hours of community service, and she is also one of the 4 valedictorians of the class of 2020. Congratulations, Anna. Next, please. Juliana Hammond announced Gabriella Monastra as the recipient of the William Bill Patterson Scholarship. Next, please. Bill came to Worcester in 1965 as the executive director of the YMCA. He later moved to Wisconsin and retired from the YMCA after 25 years, returning to Worcester. His son Todd taught science at Worcester High School until his retirement a few years ago. Bill worked for Harold Friedlander and entered public service, serving 14 years on city council and was mayor in 1993 through 1995. He joined Wooster Rotary 43 years ago as a Paul Harris Fellow and is a very enthusiastic alumnus of Ohio Northern University. After attending his 50th ONU class reunion, he found a way to support the school and honor his adopted hometown of Worcester by establishing a scholarship fund for Worcester High School senior enrolling at Ohio Northern University. Next. Obviously, the eligibility is there for a Worcester High School senior who has maintained at least a 3.0 GPA and plans to attend Ohio Northern University as a full-time student. It's a 1-year, $1,500 scholarship and goes to Gabriella Monastra, who will be attending Ohio Northern University and majoring in pharmacy. Now, before we hit the last slide, normally we're at the very end of this, and we give great congratulations by standing up and applauding everybody, but that's kind of hard to do because all we'll end up seeing is belly buttons and kneecaps. So will everybody go ahead and give all these wonderful students a big thumbs up? Thank you all and congratulations. Thank you.
All right. Thank you, Frank, for leading the scholarship committee and making the announcements and the awards. Congratulations to all of you. I'm glad you were able to be here and join us today, our students and our families. I wish you the best of luck as you pursue whatever comes next after Wooster High School. Congratulations. All right. At this time, I am now going to introduce our next speaker. Rotarian Jaime Parsons became Executive Director of the Viola Startzman Clinic in April of 2010. She has a history of working in the nonprofit organization management industry, including with the American Red Cross, the Shelby Y Community Center. Jaime obtained a bachelor's degree in pre-medicine, pre-medical studies from Ashland University, a master's degree in organizational leadership from Ashland Theological Seminary, and a Master of Business Administration from Case Western Reserve University. In addition to Rotary, Jaime's current volunteer commitments include being a volunteer swim coach and official for the Ashland Family YMCA, an advisory committee member of Catholic Charities, and Vice President of the Board of Directors for the Ohio Association of Free Clinics. Please join me in giving a Rotary Zoom welcome to Jaime Parsons. It's all yours, Jaime.
Great, thank you everyone. It's great to be here and have a nice little opportunity to share some of the updates of things that we have seen impacting us during COVID. Obviously, we've had several presentations over the last couple of months of different organizations in town and how they've been affected by the COVID-19 pandemic. And I don't think anyone was exempt, including us. So I'm going to give just a short presentation today, and I hope you'll ask any questions that you have at the end. Let me make sure I'm good here. All right, so I guess I'll start by saying happy 25th anniversary to the Startzman Clinic. This is not how we wanted to spend our anniversary. We had a lot of really fun plans for this year, including a nice celebration this summer, which unfortunately COVID-19 has had to, we've had to cancel due to the COVID-19 pandemic. We are excited to start some new planning to do some creative and innovative ways that we can highlight the incredible acts of our community and the support that you've given us over the last 25 years to make us the clinic that we are today. But the coronavirus definitely threw a kink in those plans. And so today I want to talk a little bit about how we have stretched our safety net. We have always seen ourselves as a safety net healthcare provider here in Wooster. We don't see ourselves as a competitor of any of the hospitals or of the Cleveland Clinic or any of the medical or dental providers in town. We've always viewed ourselves as that organization that catches people who fall through the cracks of any of those organizations. And with even our large health system struggling to adapt during COVID-19, you can imagine that this also had an impact on our organization. Fortunately for us, we are used to adapting on the fly, and so we were able to make a lot of changes very early on in the pandemic that allowed us to stay open and stay serving our community in some very creative and innovative ways. We have always viewed ourselves as an organization that has to care for the vulnerable populations among us. So early on in this pandemic, we found ourselves being contacted by the Salvation Army, by Kevin Franklin down at the UCC Church, by United Way, by the police departments, with some needs for our homeless populations here in Worcester in relation to medical care. Obviously, a lot of our homeless population is very sick to begin with, and then we throw the potential of a virus in, and people were very, very leery of interacting with our homeless population when they didn't have places to bathe or go to the bathroom or wash their hands. It became even worse. And so we really tried to engage in a collaborative effort within our community to not only care for the homeless populations, but the other vulnerable populations. And just to give you an idea, we currently serve between 4,000 and 8,000 patients if you count both medical and dental clinics here at the Viola Startzman Clinic. And so we have a large group of patients who are considered lower income, uninsured, or underinsured, who really fall through the cracks in a lot of different ways. So when we started looking at how we could best care for these vulnerable patients, one of the first things that we did was very early on, this was probably still late January, early February, we watched as the coronavirus came across the various European countries and finally hit the United States. And as soon as it hit the United States, we ordered COVID-19 test kits and testing supplies. And so we were very fortunate that from the beginning of the pandemic, we have been able to provide COVID-19 testing here on site, free to our patients. We, as I think every medical provider out there, had to get creative with this because with a potentially incredibly infectious virus, we were trying not to bring it into our building to protect our staff and our volunteers and our other patients. So we implemented drive-up testing. We had patients pull up into the parking lot and we tested them in their vehicles. Unfortunately, we have a lot of patients who don't have cars. Either they're homeless or they just don't have a vehicle. So many of you probably also saw the pop-up red tent that went outside of our building through this. And we're kind of in a wind tunnel up here. So we were fortunate that we had the little overhang near our dental clinic entrance that we ratcheted down this tent right in time for all the spring storms. But we were able to put a mobile operatory unit out there that we could provide COVID testing and care for patients who did not have a vehicle that we could comfortably serve them in. So this has been going on really since February, and we've been able to serve quite a few patients in this way. Like I said, we were one of the early testing sites within our community. We still have COVID-19 testing available and are utilizing it every day. But all along, we followed the Ohio Department of Health guidelines for testing. So originally, we were only testing high incident rates of folks who had other healthcare conditions, healthcare workers. We actually were one of the first organizations that was able to test some of our nursing home workers in town who were potentially exposed. So we stepped in and partnered with the health department on those tests. We also partnered with several organizations in the community who host congregate living. So situations like the Salvation Army that hosts a shelter, 180 with their shelters, some of our group homes and places like that, where if COVID-19 had gotten into one of those environments, it could have been devastating. And so we tried to come alongside those organizations and really make sure any potential staff member who was in and out, who had an exposure or who became symptomatic, that we tested them pretty quickly so that we could prevent the transmission of infection in those congregate living situations. We also flipped to telehealth pretty early in this, and I'm sure if any of you have had a physician or provider visit in the last couple of months, it may have been via telehealth. We chose to do a telehealth platform through Zoom. Actually, the very platform that we're using to host this meeting has a HIPAA-compliant healthcare platform. So we purchased that early on. Our patients have really liked it. They can use their phone, they can use their computer, their iPad, a tablet. There's lots of different places that they can use the application. They found it easy to get on and interact with. And we hope that this is something that we continue after this, because one of our primary concerns has always been eliminating barriers to care for our patients. And we know that transportation is a big barrier. So this is probably one of the beneficial long-lasting results of COVID-19 for our organization. Last week, we actually did teledental visit, which was interesting. It's fun when a patient puts a phone deep down in their mouth to try to show a dentist an area where there's pain. I think I saw Alan Kiefer on the call. He can appreciate that one. But we are really trying to be creative and meet the needs of our patients where they are and try to do as much as we can for them. Another adaptation that we've made is carside check-in. So instead of having a waiting room full of patients potentially spreading germs to each other, we ask our patients to sit in their cars and give us a call. This is the area of our front desk where we have rallied staff and volunteers to answer the phone so that everybody who calls gets a phone answered, hopefully on one of the first couple of rings. We then bring them into the building, check their temperature, and take them immediately into a room so that there is very little chance of disease transmission throughout the building. Part of our new procedures, we also designated sick rooms. So we have an area that if anyone is symptomatic, they come directly to the back of the building and in the first door. Again, just trying to be creative and utilize the resources that we have to make sure that we decrease disease transmission in any way that we possibly can. I want to talk a little bit about our dental clinic. Our dental clinic stayed open during the pandemic. We tend to see a very high rate of patients who are in pain in our dental clinic. The emergency rooms contacted us early on and said, we really need your help trying to keep dental pain patients out of the emergency rooms. Because if you remember, the hospitals were gearing up to really prepare for a COVID-19 surge. So they were trying to get rid of anything that was non-essential in the hospital. So we had some conversations early on with emergency room staff and the hospital administrations about staying open and helping to serve this population who had dental pain. You can see a picture of Dr. Gustafson in his new normal attire. Our dental staff look like aliens when they see patients now. The dental board has really come out with some strong recommendations for personal protective equipment for dentists, because everything that they do creates an aerosol spray. It's not like the medical clinic where a lot of what we do doesn't generate any aerosolization. But in the dental clinic, almost every single thing that they do puts them at high risk of disease transmission. So every dental visit, our staff wear impermeable gowns, they wear a face shield, they wear an N95 mask that's covered by a surgical mask, they wear glasses, they wear gloves. We added it up a couple of weeks ago, and it's $18 worth of personal protective equipment that has been added on for every single visit. So you can imagine the increased cost and expense and resources that we have to have just to continue to see patients. But we are happy that we've been able to stay open. We were very fortunate that we had PPE, personal protective equipment, in the clinic, and were able to obtain donations of a lot of the things that we needed. So our dental clinic is in pretty good shape, or was in pretty good shape. I will tell you that our burn rate for PPE is extremely high, so it's something that we're always looking for more of. The other thing that I wanted to mention about our dental clinic is that we have unfortunately heard that many surrounding counties are closing their charitable dental clinics. So we've already received word from 4 different Medicaid clinics that they are going to shut down after this. They don't feel like they can sustain themselves financially. And so one of the biggest needs in our community has always been dental care for uninsured or Medicaid patients. And we see that need continuing to rise during this and as we move forward, because so many of these other organizations are closing their doors. So it's going to be even more saturated than it was previously. One of the things that we were very well situated to do during this time was collaborate with our community partners. So we have always had great relationships within our community. And this was so evident in that when there was a need in our community, the directors and staff at these various organizations were on the phone immediately, texting and calling and saying, you know, we have a homeless person behind the church, the UCC church, who's sick. What can we do for them? And organizations like 180 and Community Action and Board of Developmental Disabilities jumped in to try to find transportation options, hotel quarantine options, so that we could, instead of putting them in the Salvation Army shelter, that we could quarantine them in a hotel during their period of quarantine. The Cleveland Clinic has been fantastic in helping us continue to obtain testing supplies. United Way has really stepped up to the plate in serving as a community hub for resources for COVID-19. And as part of that, they have sent us a lot of folks with health concerns, with questions, who needed testing. Obviously, Wayne County Health Department has been at the forefront of this, and we were happy to partner with Nick and his staff throughout the entire pandemic. Both hospitals, Altman-Orville and Wooster Community Hospital, we have great relationships with, and we're just so happy that we could step in and meet needs when they had them, and then when we have needs, they also step in as well. But both of the hospitals called us early on and said, if we have a surge, who do you have and what do you have that you can send to help us? And so we created a list of resources that we had, everything from our mobile equipment to supplies, to our staff and our credentialed volunteer corps. And that is such an asset to our community, that we have a core of volunteers who we credential every year. We make sure they have a valid license. We insure them through our malpractice insurance. But those volunteers could mobilize in an instant. If we had seen the surge that was originally predicted, we could have sent them into the hospitals if the hospitals had needed them, and really been able to help out as much as we could. The other organization that we've partnered quite a bit with is the Immigrant Worker Project. As many of you have probably heard, people of color and our immigrant populations have been really hit hard by COVID-19 for many, many reasons. One being that they live and work in very close quarters with each other, and there's very little opportunities for them to maintain social distancing. And so they've had some outbreaks within their populations, and we've been really trying to partner in any way that we can to get them testing, to get them supplies, to get them medical care, and do anything that we can. One of our roles throughout the pandemic has been sharing resources. So we have been very blessed and very lucky to have, number one, resources on site and some great relationships with community and national organizations to obtain needed supplies. Through the Wayne County Emergency Management Association, we heard the need that our local firefighters, early on in this, before the state and federal resources were allocated out to the counties, our firefighters were going out on calls with no masks. They were out of masks. And so we were able to rally about 800 surgical masks and donate those to our fire and EMS population, or providers here in Wayne County, to really help them bridge the gap until the federal and state resources came in. We've also been able to get thermometers. Thermometers became a hot commodity during this pandemic, and we originally got some medical grade intraoral thermometers, which are not fun, but we've recently been able to get the infrared thermometers and been able to share those with childcare agencies, with businesses who are trying to reopen. And that has been such a blessing, because if you've tried to order these off of Amazon or different places, you can sometimes get them, but when you get them, they're really low quality and tend to fall apart very easily. And the ones that we're able to get are good medical grade quality so that they'll last long for our partners in the community. The little envelopes that you see on the screen are actually 2-week packages of acetaminophen. We donated these to the Immigrant Worker Project when we found out they had an outbreak, and because most of their population cannot afford medications. And so we had a volunteer come in and package up enough acetaminophen or Tylenol, generic Tylenol, for a person to take for 2 weeks during their active transmission time with COVID-19. And we were able to do that. There's about 50 envelopes right there. So we were able to help 50 patients out in that regard. And then the bottom picture that you see is something that we called a quarantine kit. And these, we were just so blessed that we have a food pharmacy within our clinic already, that we partner with some churches and some businesses to keep emergency food enough to give away for like 1 or 2 days until we can connect our patients with one of the food banks. We were also able to get a large toilet paper donation and some medical supplies and medications. And we put together these bags and called them quarantine kits. And they were basically any patient who showed symptoms or who tested positive that we needed to ask them to stay isolated for 2 weeks and not go to a grocery store and not be out in the community. We handed them these bags and hopefully they were able to then stay home and not transmit the disease further in our community, but also be comfortable. And if any of you remember at the beginning, toilet paper was also very scarce. So being able to give each patient 3 or 4 rolls of toilet paper was actually like handing over liquid gold. We were happy that we could do that. I would be remiss if I didn't say thank you at this point. So many people in our community rallied together to support us, from Minglewood Distillery donating a couple of boxes of hand sanitizer to us, people who brought food and treats for our staff who were manning their posts during this time, and community members who brought masks, homemade masks, who cleaned out their basements and found a stray N95 mask in their painting supplies that they had never worn, and so they brought those. We were just so incredibly blessed, and we felt cared for and we felt loved through this entire pandemic. And so we just want to say thank you to all of those community members who did that. The other one that's not on here is CAMO, Central American Medical Outreach. We actually called them early on. We tend to donate a lot of things to them that they take down to Central America. And in this instance, Kathy and her staff were really able to give back. And they went through their warehouse and all of the PPE that they had available, they donated to local resources. And we were one of the organizations who was fortunate enough to benefit from their PPE as well. So we would not have been able to do this without the generous community that we live in. Ford Motor Companies donated a huge box of face shields. I don't know if you can see this. These are great face shields that our staff has been able to wear. Barry Romick and the Romick Foundation donated some other ones. And then we've had some folks with their 3D printers printing special ones that our dentists can wear that pop out a little bit further from their headlamps or their lights that are on their glasses. So we have just been super blessed by our community and want to say thank you for that. So the question that I get now is, what's next? You know, is this our new normal? Will we see a second wave now that social distancing is kind of phasing out and the economy is reopening, which is a wonderful thing? Are we going to see a higher rate of infection? And I think any of us in the healthcare industry recognize that, yes, we will. But we're prepared for it at this point. We have adequate systems in place. We have developed procedures to deal with folks who are potentially infected. We've gotten past the fearful period that I think was the first 2 months. I will tell you that I think the biggest point of exhaustion for our staff and volunteers during those first 2 months was the fear of the unknown. We were dealing with a virus that we knew very little about, and there were not a lot of resources out there to help us chart a course through that. And so we really were kind of feeling blindly in the dark. And that fear of what do we experience when we come home to work? What do we take home to our families? What happens if one of us gets sick? That fear was really exhausting at the beginning. And I think anyone in healthcare can now say, we're kind of past that point of fear. There's still a lot of unknown about this virus, but there's enough known that we're not as fearful as we were back in the beginning of March when things were so unknown. So we think there will be a new normal in healthcare. I think that we'll swing a little bit back closer to what we used to look like, but it'll never look exactly like what it was. I think that this has made us think very strategically in terms of infection control. And so some of the new normals for us are that we are going to be moving every single one of our dental operatories into a room with a door. Most of you, when you go to the dentist, we all have kind of open bay operatories where there might be just an open space that has 2 or 3 chairs and maybe some cabinetry separating it. We're moving away from that. We're going to be moving every one of our chairs into a separate room with a door with different ventilation systems. We're hoping to switch to digital x-rays here at our clinic. These are all very expensive things to do, and so we're going to be launching some campaigns to make sure that we can do that effectively and adequately in the future here. But a big part of what that means for us is that we can't fit in our current building anymore. Right now, if we have to move every dental operatory into a room with a door, that pretty much takes up every exam room in our current building. And so you were the first to hear this in the community today, other than my board, which I have several board members on here. But we have purchased a new building. So this is going to be our new medical building. And if you recognize this building, it was the Cleveland Clinic Women's Health Building. That's really just a stone's throw down the street from our current building. This is going to house our medical clinic, and these are some before pictures. There are 26 exam rooms in this building, which gives us some room to not only grow our medical clinic, but to partner with community organizations to have them, especially some behavioral health agencies, under the same roof to serve our patient population. But then it allows the space at our current building to be utilized effectively and safely for dental care. So our dental clinic will remain at our current building and our medical clinic will move down to the new building, which is not ideal, I'll be honest. I've been a little bit nervous about splitting the organization because there's just a lot of moving parts in both of those. And so I think that I'm just gonna invest in some roller skates so I can get up and down Cleveland Avenue pretty quickly and be able to be at each building as we need to. But we're excited about the timing of this, that the building became available, that we were able to work with the Cleveland Clinic leadership to get access to the building. And we're actually hoping to move in next week. So call me crazy, but we really pushed through this in a very quick period of time, mainly because of the fear of running out of space and putting people in too close a proximity here in our current building. That when we had this opportunity, we really wanted to take advantage of it for the safety of all of our patients. Another part of our new normal will be continuing to do our mobile outreach efforts. You can see that through the pandemic, we were able to buy a trailer and get the clinic's logo stenciled onto the side of that. So if you see that out in the community, it probably means that we are somewhere nearby doing either a vaccination clinic or a dental outreach clinic, or maybe even some COVID testing. We've had to buy some additional personal protective equipment and some physical shields that we'll use during those outreach events, but we're very excited to be able to continue that. For example, we got a phone call about 2 weeks ago from the Christian Children's Home of Ohio. We usually provide all of their dental care, and it's really difficult for them to come out and come into our dental clinic, especially right now with some of the new restrictions and infection control procedures. So we actually just scheduled 3 days in early July that we're going to be sending a dental brigade out to the Christian Children's Home of Ohio to perform all of their dental care on site for them. So that really eliminates or reduces the chance of infection for them and makes them more comfortable and will be more effective in the long run. So we're happy that that will continue to be a part of our new mobile outreach. We're also looking at implementing some community health workers throughout our service area and continuing to use telehealth during that time. So I guess I just want to end by saying we always need you. Our clinic is here because of you. Our clinic has been built on volunteers and donations, and that still does not end. Right now, we need you more than ever, more than we ever have before. We've had to cancel a lot of our fundraiser events this year because of the coronavirus. And what we're doing is very expensive. For example, our COVID-19 testing, which we're committed to providing for free for our uninsured and underinsured patients, costs us approximately $200 per person. Even if that patient has insurance, we got our first reimbursement last week and it was $42. So there's still a very big gap between what we get reimbursed and what it costs us to do the testing. And we can't continue to do that without the support of our community. I hope that you'll come alongside us and support us during this time. As with all of our social service net and safety net here in town, we all need you. And we're all so appreciative of what you've done for us through the coronavirus and always. So with that, I will take questions. And if anybody has anything, I would be happy to chat a little bit.
If anyone has questions, you can plug it into the chat box. You can unmute yourself and just shout out your question. If you're joining by phone and you'd rather send an email, you can email Lynn with a question. While we're waiting for a question, Jamie, congratulations on the new building.
Thank you.
That's exciting.
It's very exciting. It's intimidating, but it's exciting.
For you to at the last minute agree to do this presentation and then say, oh, by the way, we're moving next week. That's crazy.
This got me out of packing this morning, so I
Oh, good.
it. It was a good break.
Questions for Jamie, anyone?
I see Dawn has a
Don,
question.
okay. Don, hold on a minute. Let me see if I can get you unmuted here. Oh, okay, go ahead, Don.
Jamie, I know it's a complex operation and so forth, but I'm wondering about, are there specific needs for volunteers you're trying to fill right now?
Thanks, Don. That's a great question. One of the hardest decisions that we made at the very beginning of the coronavirus was to put a lot of our volunteers on hold. Obviously, Dawn is one of our volunteers, as I see several of you on here that are volunteers. And we wanted to make sure that we weren't bringing volunteers into an unsafe environment. And so we really kind of pushed the hold button on volunteers. Right now, we're going to be re-engaging our volunteers starting in July. Obviously, Don, we have 2 buildings to clean now. So we will continue to need our volunteer custodians, as well as folks who are willing to just come in and answer phones, be greeters, be temperature checkers at the front door. All of those positions are going to be really important as we have to do that in 2 separate buildings plus our outreach sites. So obviously we would protect you and give you the appropriate personal protective equipment, but if anyone is interested, we would love to have you. We're also re-engaging our student population. So the Career Center students that we typically host, nursing students, medical students, dental students, all kind of different healthcare profession students, we'll be re-engaging with them and bringing them back on board to help as well. Great question, Don.
Thank you.
Anyone else?
Well, if anyone has any specific questions or wants to get involved in any way, just reach out to me. I'd be happy to chat with you.
Jamie, thank you. I really appreciate you making the time to share with us and give us this update. I would ask, just in addition to the volunteer needs, I'm guessing funds and PPE are additional needs. What would you, if you had your top 2 or 3 priorities, what are they right now?
Funding is always going to be our #1 priority, simply because testing is so expensive and supplies are so expensive. We do have some routes that we can buy PPE, but I will tell you what cost 63 cents prior to the pandemic costs about $4 now. And so we're still able to buy those in bulk, probably a little cheaper than any of you could find masks at Walmart or wherever happens to be selling them now. So if you make a donation, we can stretch that a little bit further. But if anyone is doing a summer clean out in their basement and finds N95 masks, those are still so hard to find. When we have ordered N95 masks, we have received KN95 masks, which are not the same and are not as effective for our staff and volunteers. So if anyone finds unused N95 masks, or if your business has a way that you can get those, we would love to partner with you.
Okay. Good. And I will, just one other comment I will make, and that is for all of the gifts and contributions and donations that you receive, the fact that you are sharing your resources with other agencies and the way that you have been able to help the community widespread is just amazing. So thank you. Thank you.
You're
Thank
welcome.
you.
I think we all recognize this, that we're in this together, and we can't do this without their help, and they can't do it without our help. So that is one of the neat things about Wayne County, is that we have such a strong network of collaboration, and we're just proud to be a part of that.
Great. Thank you. Okay, a couple of reminders. Flag Day is coming up. And so flags will be going up again for the June 14th holiday. They will remain up through Independence Day. So as you are out and about in the Wooster community, if you see flags that are in need of help or repair, be sure and let us know. Report that to Brent, if you can, Brent Rice, who will be coordinating our troubleshooting efforts. But look for flags to go back up again here shortly. Next week, our program will be delivered by Dr. Michael Tefts, Superintendent of Wooster City School System, and he will be doing an update on the Wooster City Schools, which is one of the programs that was scheduled for back in March, and it was one of the dates that we did not meet. So a lot has changed since then. Michael has some different updates now than he would have at that point, but he'll be here with us next week. And so as we close this second week of the month, again, I will ask that we keep that second question of our four-way test in mind as we move through this week, and that is it fair to all concerned? Thank you all for being here. We stand adjourned.
Thanks, Jamie. It was wonderful.
Yes, thank you, Jamie.
Thank you.
All right, take care all. Have a great week.